When we were looking at posture in the standing position, we looked at pelvic orientation. And this test, the Thomas test, is designed to take that information further. So when a person is standing and their pelvis is level, they need to be able to take their hip back into extension without the pelvis tilting forwards. And in order to do that, they need an adequate amount of flexibility on the front of the hip. So the structures at the front of the hip are essentially the iliofemoral and the pubofemoral ligaments, the hip joint capsule, and our hip flexor muscles. And this test is a measure of those hip flexor muscles. So it's actually a modification of the original Thomas test, which of course was an orthopedic test. But this modified Thomas test is designed to focus more on to muscle of the hip flexors. So we start with our subject lying flat on the bench, and we would have conducted a hip examination to start with to make sure that we know that this test is relevant. And what we're going to do is to flex one hip and measure the subject's ability to maintain the other hip in extension. And the thinking behind this is that if I want to keep my pelvis level and extend my hip, that orientation is approximately equal to me flattening my lumbar lordosis and having a neutral hip. Okay, so we'll start off by getting our patient to the end of the couch and then making sure that they have clearance between the end of the couch and the back of their knee. So if you could please just shuffle down to this end of the couch. And if they find that it's difficult to do that, obviously we would support them. So we're starting off with about 3 inches behind the knee clear of the end of the couch, and then support your patient as they go down, and the knees can be bent so that the feet are flat. So in this position then the lordosis is now flattened and the pelvis is anteriorly tilted. So I'm going to get the subject to maintain that position. So what I'm going to do with her permission is to move the knees up, and then I'm going to press the knees onto the couch, and with my hand I'm just palpating the back of the pelvis onto the sacrum. So I'm going to press into flexion, come back until I feel that pelvis is in its neutral position, so the sacrum is just in contact with the bend. So I don't want her coccyx and sacrum to be flexed right up. So if you could now just hold on to this knee. So we're holding the knee, and once she's held that knee, I'm going to extend the other leg. Now I'm going to swap round, having shown the grasp on that knee, because it makes it easier for the camera to see. So this stays in position, and monitor that position with your hand as your subject lowers the leg, and just support the leg as they come down. So what we're looking at then is their ability to keep the thigh level, so the femur is on the couch, and then the knee should be flexed to 90 degrees. So we've maintained that position, and I'm looking at the orientation of the femur. And if you just come back again and just rest your feet down. So we saw in the lecture that we're checking at a number of things. So once we've set the pelvis up into its starting position, we're supporting the leg, and as that leg lowers down, we've got a couple of things to look at. Firstly, does the femur contact the couch, or does it stand proud of the couch? So if you could just hold onto your knee once again. So if this leg is held here, that would be an indication of tightness over the front of the hip, so tightness in the hip flexors. But because we've got the iliopsoas and the rectus femoris, which are placed on stretch, remember that the rectus femoris is a two-joint muscle, a biarticular muscle, whereas your iliopsoas is just a single-joint muscle in terms of the hip. So where the leg lies down and is extended into this position, the knee is extended, that is more likely to be tightness in the rectus femoris, whereas when it's in this position and the knee is flexed to 90 degrees, the tightness is more likely to be in our iliopsoas, and we could then measure those two individually. As that leg comes down, I want to see the alignment of the thigh maintained. So at the moment, if I take a line from the subject's shoulder to the hip to the knee, it's in a continuous line. But if that leg as it comes down swings outwards into abduction, that would make me think that perhaps the tensor fasciae lata and iliotibial band is also a limiting factor. And then as the leg comes down, if you could just sit yourself to face round facing the camera. As the leg comes down, we want the thigh to be vertical. So the shin should be vertical and the femur should be in line with the body. So if the tibia is rotated, that would suggest a rotation of the femur. So looking more closely then, the femur wants to be in line with the body and the tibia wants to be hanging down vertically. So this would be an indication of femoral rotation, and this would be an indication of femoral rotation, which we would then investigate separately. So that's our Thomas test then, and the Thomas test is a measure of hip flexor tightness.